to know myself well enough to know what triggers me or what gets me into a difficult place, and how am I going to get back from it. So that's a fundamental program. The other one that in my schooling that I found out, and it's come out of a School of Social Work in the States, in Kansas, is a strengths-based approach. That's what it's called. It's a practice approach. And I've developed a kind of a recovery education program around that, so that, because they've developed a strengths workbook, and then they never intended to have a certification program or anything, but a guide if you want to facilitate, because it naturally lends itself to groups. And I like self-help groups, so I've adapted the strengths approach to a 12-week learning about how to explore our strengths using the strengths workbook. So when people do that, they can go from, well, you know what, I'm getting a handle on my life now, and then the strengths-based approach is about, okay, you explore different domains of your life, like maybe work, your spirituality, sexuality, a number of things that don't get touched on in the mental health system, and then also your strengths, and peel them off, or uncover them, so that you know you and believe you have strengths. And then the third one is the work that Sherry does, and that's around, and I like to do peer support and peer support groups. And it's about figuring out what relationship is all about, and how do we connect, and how do we have a good relationship. And that's really what intentional peer support is about, is figuring out how to be honest, how to negotiate our way in a relationship. And most people, by the time they've done that other work, they're really ready for this, because they want to be in relationship. And so many people are isolated. So those three programs, in my mind, really can open up doors for folks when they've had, you know, any kind of thing that's just not put them in a place where they may have thought they weren't going to survive, they weren't going to have a meaningful life anymore. And people can, with self-help, if they can believe in themselves, learn from others who've had similar experiences, they can do that. So my passion is about getting these programs, as Sherry was saying earlier, getting these programs into the alternative, not as an alternative, as a core. It should be in every place that's providing service. Should, you know, the first question I ask when I'm invited into agencies is, I just say, so how are you delivering, or how are you providing recovery education for every single person who's receiving services in here? And it stops them, because they're hoping their staff does it somehow. Their staff does recovery.
Osmosis.
Exactly.
It's a milieu.
Yeah, they've just come in here and they're going to recover. Well, it's hard work. And self-help groups, that's going to be one of the biggest shifts for traditional agencies and providers, because they have to let go. They have to provide an environment that's going to nurture this, but they have to let go and let us do the work. You know, let us help. Let us believe that we can help ourselves. And that's the work. You asked me earlier where I was. Oh, well, York University. So I'm affiliated there, and it gives me a lot of credibility, because you know what? I've got a social work degree, so it helps me get in the door because I do a lot of work with providers and with families. And because of that, I think it's a lot of because I do that gets me in the door. But also, I'm connected with the Craftsman Center and Tanya, and Kate Story is another player in this. And we started working on a project called the Culture of Recovery Project 2 years ago. And it's actually to deliver these core programs along with some basic education for providers, and also the one piece I didn't mention, but it's absolutely crucial for healing, is understanding how we internalize the discrimination around this. So we're doing work around discrimination as well, and I build that into each one of the training programs that I'm involved with too. So because we have to heal. You know, we can figure out how to manage our symptoms, we can do whatever, but if we don't get a chance to have the relationship where we can tell our story, to talk about our experiences, Because that's when you start to heal, is when you're in relationship and when you can talk about and hear what other people say. And some people will go an entire lifetime and not heal, not have that healing. Their lives will have been had that impact and won't have healed from that. They can do the other things, but we all deserve to have a full life.
Well, sure. You know what struck me when you were giving that overview, that this applies to the general population. It's nobody is without loss and without crisis in their lives, and unfortunately, so many people don't learn to deal with it very well in terms of their own health.
Yeah.
So those are the cornerstones to me, is what you were describing about looking after yourself and how you relate to others is a key part of that.
And so why wouldn't that be, if you've had these experiences and you go into a service to try to get some help, why wouldn't that be where we would start? I mean, actually, it's mental health promotion. It's not really, and prevention, it's not really, I mean, if you want to call it treatment, that's what people would call it.
Sure.
But it's really about us promoting our wellness.
Sure. Living your life to the fullest possible.
And you know what? I got lost somewhere. I took a hit. I got lost, and I got to figure out how to get well again in all aspects of my life.
Fascinating. Wow, the sirens are coming.
Yeah.
Thank you very much, Anne, for sharing your story and where you fit in with this week's event here in Richmond Hill. Thank you very much.
Thank you then.